All right, in this lesson, we're going to take a look at intake and output. And as we first get started, what I want you to look at is this abbreviation. It's called I&O, and you're going to see it a lot throughout nursing school, and you're going to see it a ton in the facilities you're in. And what it stands for is intake and output. And a lot of nurses are going to refer to this. So when you hear it, think about intake and output, and your ears should just totally perk up when you hear it. Now, intake and output, when we're talking about it, are ways that providers can check for fluid imbalances in patients. They can look at things like their current volume status versus their risk. So some patients are at risk, or they are currently, they'll have like a fluid volume excess or deficit. And when we're talking about fluid volume excess, we're talking about extra fluid. And with the deficit, we're saying they have too little fluid, so they need fluid. They have a fluid need. This is really important for your renal and your cardiac patients. So extra fluid in a kidney or a cardiac patient could put extra stress on the kidneys or cause an extra workload for the heart. So be thinking about that. One little pro tip that I want to tell you about real quick is that when you're weighing your patients daily, which you should be doing, you may see changes in body weight. And what I want you to look at here is 1 kilogram of body weight is equal to about 1 liter of fluid. So let's say you weigh your patient in the morning and they're up 3 kilograms. What you can expect is that's going to be about 3 liters of fluid extra. So this will help you with trends over time, and you can see, you can keep track of their fluid status and see if they have any changes in those trends. So let's get to the nuts and bolts of intake and output. And this is, in these types of situations, this is where your intake and output are going to be really important. So for your patients who are on fluid restriction, these are going to be maybe your kidney or your cardiac patients. This is where it's going to be really critical in precisely measuring their intake and output. You want to make sure that you're keeping track of everything and keeping an eye on their overall fluid status. So be mindful of that when you're taking care of renal and cardiac patients. The other type of patient that you're going to want to pay attention to the I's and O's are on your critical or your unstable patients. These patients are really susceptible to these fluid shifts. So any little bit of fluid in the wrong spot could make a huge difference in their outcome. So pay attention to how much they're taking in and how much they're putting out. Another time you want to think about intake and output are when you have patients that are on IV fluids or they're on a diuretic. IV fluids should, for your patients that are on IV fluids, it goes directly into their cardiovascular system, and they're going to be really susceptible to any small change. So you need to think about their fluid rate and stuff like that. We're going to talk about that a little bit later. But the important thing that you need to focus on too with diuretics is diuretics promote to kick out more fluid. So if they're just dumping a bunch of fluid, you need to think, hey, what's going on with their overall fluid status? And we need to pay attention to what they're taking in and how much they're putting out. So this is intake. So what exactly is intake? We're talking about fluids by mouth. So these are liquid things that they're taking in. Solid foods have some liquid volume, but what we're going to be measuring is liquid, so fluids going in. So these are things like coffee or juice or broth or even ice cream. What you want to be thinking about when you're documenting and you're looking at intake are the amount. And coffee usually has like 180 mils to 200 mils per serving or per cup. Juice has like 120. So if you ask your patient, oh, how many juices you have? Oh, I had 2. So you could say, hey, we 120 times 2. So they had 240 mils. And those things contribute to their overall fluid intake. So the best thing you can do is to check the container, and they're going to have a label on it that says how much is in it. Quick tip about ice chips. Some of your patients are going to get ice chips. What you want to record is the volume of half of what you gave them. So if you give them 8 ounces of ice chips, it actually is 4 ounces because of the size of the ice. So that's just something that you need to keep in mind. Just a little tip for you. The other thing you need to keep track of are their tube feedings. So if your patient has do they have a PEG tube? Do they have a JG tube? Do they have any sort of tube feedings that are going in? They're going to have a pump that's similar to this guy, and you'll be able to clear it, and you can check the overall volume for the tube feeding that your patient is getting. The other thing you want to keep an eye on are your IV fluids for your patients. You want to check their fluid rate. You want to check their fluid volume, because sometimes you'll have to check them over a shift or over a time period. You'll have to, like we commonly did 2 o'clock. We would check their We would clear the pumps to see what they had and document their I's and O's. You want to make sure that your patient's not getting too many fluids, make sure they're not getting them too fast, and you want to make sure that you're using your 6 patient rights to make sure they're getting the right fluid for the order. Sometimes your patients are going to have something called a fluid restriction. And with your fluid restrictions, you're going to see this in like your cardiac or your renal patients. And what you're running into with your fluid restriction is that you're saying, hey, they can only have X amount of fluids per 24 hours. You'll also get this other thing called a strict INO. And what that means is that you are going to monitor every drop that goes in and every drop that goes out. So this is really standard on your ICU floors, but not so much in your med surg. So if you have a patient that's on the med surg floor and they have a fluid restriction, expect them to also have this strict INO order. And if not, it's just good practice to stay on top of everything that goes in and everything goes out, because the providers are wanting to measure everything. So just measure everything in and everything out, make sure it's always precise, and make sure that everything's always accounted for. When we're talking about output, we're literally talking about everything that comes out, any of the fluids coming out of the patient. So whether that's something they're eliminating, or maybe they're throwing it up, or if you have a drainage from a wound or from a drain, these are the things that we're talking about. If your patient can eliminate on their own, make sure that they know how to use whatever tool, when I say tool, whatever receptacle they need to go. So let's say they're using a bedpan. Give them the bedpan, let them use it. And then what you need to do as a nurse is you need to use this thing called a graduated cylinder. It looks like this. It's this clear, triangular looking thing, and it's got these measurements. So when you get done, pour it in here, measure it. You can do this with your drains as well. But what this does is this helps with accuracy. If they can get up and go to the toilet to use the toilet, then you need to put something called a hat. So let's say this is the toilet. Here's your little handle. You're going to use something called a hat, and the hat sits in here like this. And it's got this little circle. And what they need to do is, it looks like a hat. They need to pee into here. They don't need to pee in here. They need to pee in here, because you can measure this in here. It looks like a little cup inside, but you want to make sure they're going in there. So it's all about making sure that you're educating your patients here. Making sure they know where to go and how to use the things that you're giving them. If you have a drain, you should be able to just dump it out and measure it. But let's say you have a draining wound, this is where it gets a little bit tricky. What you do, so this is your patient, they have this draining wound. What you can do is use a disposable pad. And let's say this is your drain. You actually measure the pad. So you're going to put it on a scale. It's going to tell you how much it weighs. What you can do is, so the trick is 1 mil is a fluid is equal to about 1 gram. So let's say your drainage weighs 500 mils. You could say, let's say it weighs 500 grams, sorry. Then you could say that would actually be 500 mils. So that would be your output for that particular drain. The thing that you want to know is this: everything that comes out of your patient, you need to measure it. That's kind of the big takeaway here, is you want to measure absolutely everything that comes out. That way you can keep a good idea. If you've got a patient that has an NG tube to suction, it's going into the suction container, measure that. If your patient has liquid diarrhea, make sure you're measuring that. Some units require you to measure all stool. I've been in some, they said, hey, yeah, we want to measure absolutely everything. And sometimes we're like, we only want liquid diarrhea. So just pay attention to what your policy is for that. But just find out what that is and follow those procedures. For nursing concepts today, we really talked about fluid and electrolyte balance whenever we're talking about intake and output. And this also focuses on nutrition and then elimination aspect for our patients. Okay, so let's recap. We want to absolutely measure everything. Everything needs to be accounted for. So everything in and everything out. When you're talking about intake, know your measurements. Make sure that you've got your little containers that tell you how much juice is in their cup, or how much it'll say on the bottom, maybe a coffee cup. Always refer back to those little containers to find out what the measurements are for your patient's intake. Always make sure that you're measuring your patient's output. You want to measure everything in and everything out. So these are your drains, all of your containers that they've got. If you've got this oozing wound, make sure you're measuring absolutely everything. You also want to focus on educating your patient. If they need to pee, into the toilet. Make sure they have a hat so that you can actually measure it. Make sure they know where they need to be eliminating to. Make sure they know how to use the tool. And if not, you need to educate them. Lastly, on your I's and O's, make sure that you're following protocol. So if you have a strict I&O policy, make sure you're following that. Strict I's and O's that's not only for your ICU patients. So if you have a strict I&O, expect maybe a fluid restriction. Just pay attention when you see these kind of things, because it means you are responsible for everything in and out of that patient. So that's our lesson for intake and output. Make sure that you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.